I'm going to talk about acute prostatitis. It's one of the conditions which are most common in the prostate. The main conditions which affect the prostate, it's usually the cancer, which we worry about mostly. And then it's acute prostatitis, chronic prostatitis, and the benign prostatic hyperplasia. That means the prostate getting bigger with age. The one that I'm presenting is acute prostatitis, which mostly it's bacterial. It's common in patients who are less than 50. It also affects people over the age of 50. It's the third commonest cause of rising PSA in elderly patients. So how it presents mostly, it presents with pain in the lower pelvis, in around the perineal area. It comes with lower urinary tract symptoms, for example. It will be difficult in passing urine, where the stream becomes low. You may have pain with the passage. You may have burning sensation when you urinate, or incomplete voiding and dripping after urinating. It's usually also associated with systemic symptoms as well, where you feel fatigue. You may have fever as well if there's septicemia. And then how we diagnose it: when you come in, you tell us about the symptoms, and then we do a quick examination. Part of the examination is to do a digital rectal exam. We may pick up that there's tenderness around the prostate. In the worst case scenario, it's when you have abscess in the prostate as well. We feel a fluctuating mass in the prostate, and then we'll make a decision on that. When we do a urine test, we may pick up signs of infection from the urine, and then we'll also do an ultrasound. With the ultrasound, we basically look at the whole urinary tract from the kidneys, the bladder, and the prostate if we may see it. In some instances, when we suspect that there's an abscess, what we'll do a CT scan so that we can see the masses around the prostate, and especially if there's an abscess around there. How we treat it, we may need oral antibiotics, but when there's signs of sepsis where there's systemic reaction, we may need to admit you and give you intravenous antibiotics. We also add tablets to reduce the inflammation, and also tablets to open up the bladder neck so that you pee much better. In the worst case scenario, we may need to insert the catheter. If the complication of an abscess have developed, we may need, depending on the size, we may need to drain it. And draining it can be transperineal. With a needle, we aspirate that abscess out, or we do a transurethral resection of the prostate so that it drains out. The risk factors for it, it's most commonly in patients who are diabetic. They usually get the inflammation of the prostate, or if you have already a big prostate and you're not emptying very well, or there's a pressure when you urinate. Some of the urine reflux is through the prostatic ducts or the ejaculatory ducts into the prostate, and then that leads to an infection. All right, so the treatment, when we done with an acute treatment, some patients may develop what we call chronic prostatitis. It can be bacterial or abacterial. That would mean that your prostate is inflamed for a bit longer. Some patients may end up with what we call chronic pelvic pain, where they constantly have pain in the pelvic area and the perineal area. It may need surgical intervention like transurethral resection of the prostate so that we open up and there's free flow of urine, which is not under pressure. In some patients, we don't need to do that. We don't do much. We just need to monitor the PSA. If you are above the age of 50, the problem is that it also increases your PSA. We may need to monitor you very closely because it can mask the presence of prostate cancer and other problems of the prostate. But usually it is treatable with antibiotics and anti-inflammatory drugs, including the alpha blockers to open up the bladder.